Hello, good evening, viewers, and anyone watching us on iAfrica TV right now. This is the platform that brings you special program on the coronavirus. Right now, it is a global pandemic, and in the Gambia, there are 4 cases confirmed so far. So these panels will do its best to bring you the latest update as to the fight on against this big disease on the 4 corners, within the 4 corners of the country. So that's what we're going to do right now. Today we will digest all the discussions that lasted within this 24 hours within the country. And I have a very important guest to discuss this important program. With me is actually Usman Sila, who is the chairperson of the Select Committee for Health at the National Assembly of the Gambia. Usman, welcome.
Thank you very much, Mr. Ba, for having me on your program.
Next to him is our gentleman, Gabriel Gando Balde, who is Program Officer at the Communication Unit under the Directorate of Health Promotion and Education. Gando, you are welcome.
Thank you very much, my brother, and thank you for having me. Yeah, it's a pleasure.
On the line, I have Fatou Cisse, who is a social worker and activist who is based in the United States, Georgia. Fatoumata, you are highly welcome.
Thank you, and greetings to those on the platform there. Thank you for having me.
Welcome. Gentlemen and lady, and now what we will do is to digest the situations in the Gambia. As we know, there are 4 cases confirmed medically in the Gambia, and for the past few weeks, all attention is being subjected to, to the fight against this disease, and it is spreading, and a lot of messages are coming from the health experts, and people across corners are discussing the disease, and efforts are also being made to, surmount the situation in the country. So just to start with, Mr. Silla, what kind of situation are we in for the meantime?
Thank you very much, Mr. Ba. Once again, yes, we are in a very critical situation. Critical in the sense that this is the first time that the Gambia is experiencing such a looming threat as a nation, and that public health emergency, and it's not Gambia alone. I think this is a challenge that is facing all countries around the world. And as you know, the World Health Organization declared this epidemic initially as an issue of public health emergency. By then, it just started in China, Wuhan, and then the situation was getting worse to a point where the World Health Body has to declare it as a pandemic, that it is something widespread and therefore needs urgent attention. So Gambia, as other countries, is contending with this, and we're expecting that it is going to affect the population, and not only lives, but also livelihoods, because as you know, in those countries where it has gotten worse, they have resorted to a lockdown where all movements are stopped, and the normal life becomes abnormal. So that's the reality. The situation that we are facing is that it's not business as usual. It's not a normal situation. It's an emergency situation. It is an extraordinary situation. So therefore, the responses to it, the approaches to it, must be abnormal, must be emergency-like. So this is what we are facing as a country, and then we have to get ourselves prepared. Of course, nobody wishes the worst to come, but we have to be in that mode to prepare for the worst. It might not be worse as one expects it, or we don't wish for it to become worse. But if we prepare ourselves, if we have that frame of mind, that state of preparedness as a nation, that state of preparedness as communities, the state of preparedness as individuals, then we'll be able to confront it, and that is where we are. Now, there are so many stakeholders. As we said, every person living in this country is a stakeholder. Gambian, non-Gambian, young, old, male, female. Every person is a stakeholder. Every person has a role to play at the personal level, at the community level, and at the national level. Government has its role to play. The state institutions, the National Assembly, the Executive, Minister of Health, taking the lead as far as the Executive is concerned. The population also, communities have a role to play. Households have a role to play. Individuals have a role to play, because you can see the responses that are required. So each of these layers, these stratas, has a role to play in this, in terms of preparedness and in terms of response. So this is where we are. I think as we get along, I might be able to elaborate more on what we're doing at the level of the Assembly.
So in your view, the fact that it is a global pandemic means it is also a national pandemic. I think we get this message, Mr. Balde. You know, at the local level, how is this pandemic explained in the country here?
Yeah, thank you very much. As Honorable rightly said, the Gambia is not alone in this fight. This is a global problem. And then I think this is the first time we are experiencing such a pandemic, you know, in such a nature, whereby the 196 countries today are affected. So that qualifies this disease to be a pandemic, because you don't only find this disease now in China, where it originated in Wuhan, but across Europe, all the countries in Europe are affected. They are having cases. And now going to America, you understand, North America, South America, they are all having cases now. And Africa is not also left behind in this. So that's why a disease that have crossed boundaries of international borders, you know, have crossed continents, you know, that is the nature of the disease. That's why it is called, or it is being described as a pandemic, as a global disease that cross borderlines, and then that even cross across continents, as I said. So for the local people to understand, they have to know that we are dealing with a disease that is so contagious, in a sense that the disease is spreading from country to country on a daily basis.
Yeah, Honorable Sila, we know that following the declaration of this disease as a global pandemic by the World Health Organization, we saw government coming out in 2 occasions through the president to say firstly that, I mean, public gathering is no more allowed. And later on, there is a declaration of a state of emergency, state of public emergency, where people are not allowed to gather, people are not allowed to, especially those dealing in non-essential services, are not allowed to operate. So looking at the chain of actions being taken by the government, how do we describe the response mechanism? Is this in line?
Yes, thank you very much, Mr. Bob. But before I get into the latest responses from the government, let me just give it perspective as to how it all, began, as far as the Gambia is concerned. As you know, it was on the 29th of January, 27th to 29th of January, that the World Health Organization declared this as a matter of public health emergency, the disease, COVID-19. In fact, it was called coronavirus because it's one of the coronaviruses. But later on, they have to christen it, give it another name, that is COVID-19.
COVID-19.
A specific name. It's one of the SARS, S-A-R, something acute respiratory. Well, I think the health officials can help us in that. Severe acute respiratory syndrome, SARS. So this is the SARS-2, and it's called COVID-19. After that declaration, the Gambia government started a process, kickstarted a process. But as a National Assembly, as an oversight, the committee that I chair, that is the Select Committee on Health, we felt that we need to engage the executive to know what Gambia is doing, because the whole world, particularly then, it was in Wuhan, but it has started coming out into Europe. So we felt that this is something, and by then, in fact, the WHO Director General was saying that they have not yet declared it as a pandemic, but if countries do not do much, it might come to that stage. So as a committee, we met and felt that, well, there is need to invite the Minister of Health and his team to come and tell us the situation with regards to this disease, and then what is the state of preparedness as far as the government is concerned under the leadership of the Minister of Health. So we were able to get this. The minister came on the 7th of February, and then he was able to outline what has been done so far. By then I mean that a press release was issued, and that they had established committees, technical committees, and then also shared the plans that they had in terms of how they're going to engage in terms of preparedness, I mean. So as a committee at that meeting also, we gave some recommendations to them as to how we feel these things should be attended to, this issue. The preparedness, how to get ourselves prepared in a robust manner in terms of the responses. So, and then from there, as a committee also, we felt that, well, we had to give them time to see to see how things would pan out. And after a while, as a committee, we felt that, well, it's good for us to roll out, to go to the areas that are key to whatever state of preparedness Gambia wishes to engage in. So we felt that the points of entry, that is borders, international sea and land borders, had to be visited. Also facilities that are supposed to be attending to suspected cases and eventually patients, that is, they call them holding centers and isolation centers. So we visited all these places, but then this was on the 3rd and 4th of March. What we found out was that generally there was not adequate state of preparedness. It was not adequate. There were some challenges at the level of the points of entry, at the level of materials, protective materials. So we were able to highlight this, and then interestingly, the day we laid our report at the assembly with the recommendations for government and for all the other partners, not only government but the partners, the NGOs, the civil society, the media, individuals in the country, all those stakeholders had been, tasked to come up with responses as to how to get ourselves prepared and respond to this outbreak. Because in fact, it was that very day in the evening that the Gambia declared a confirmed case. They confirmed a case. That is the first case. So this is what we have done. Okay, so coming to the state of emergency.
You sure, but meaning that the National Assembly Select Committee on Health has been on the background looking at exactly what information is useful for government to take necessary action.
Yes, and I can also tell you that the committee, most of our recommendations, I can see that the responses of government, by and large, are taking cue from the recommendations we presented as a committee. That was adopted by the plenary of the National Assembly on the 17th of March. So you can see after that, even before that, because we shared it with the official, particularly the minister, we are closely engaged because, of course, we do perform oversight. Our role is to perform oversight. We are not going to, we shouldn't be implementing on behalf of the executive. We perform oversight. But there are areas where you need partnership. Like as we are speaking now, I can inform you that and the population that the National Assembly members have now rolled out to their constituencies and are engaged in sensitization. So this is not taking the work of the executive, but we are representatives as well. We do advocacy. So we are doing that. We are doing this in concert with them. Okay, coming to like I said, we started very early. We were very proactive as an oversight. We started at the right time when things started. So, and we have been engaging the ministry. We have been engaging them in our oversight. We have been engaging them. And then coming to this public emergency, yes, it is a requirement of the Constitution that when the country is faced with certain situations, grave situations, Section 34 makes provision for the President to declare a state of public emergency. And then Section 35 also of the Constitution provides for an act. And then when you talk about an act, it's the National Assembly coming up with an act, a law, that is going to prescribe what powers are going to be, implemented. What are the powers that the President is going to invoke in terms of, implementing this emergency situation. So, and then as I speak, the National Assembly will be convening on Thursday, this Thursday. Perhaps
okay, we come back to that quickly. Just beg, like, Fatoumata, you are on the line and you live in the United States, and this is a situation that is happening in your country back home. So how, what eye does somebody in America will see in the case of Gambia right now?
Thank you very much. As somebody living in the situation and happen to work with people also who are affected with it, even though all of us are affected, it's just one way or the other, either directly or indirectly, or you might be affected financially, if not your physical health, but also mental health. For Gambia, I would say some of my thoughts, because what happened in America and what we are facing right now, America being the epicenter, more especially around New York area, I don't pray that to happen to my country, and we are not wishing that to happen in the Gambia as well. I'm glad that the president came out and then gave out his speech and then declared a state of emergency. It's like I will take an example as of a plane. In the beginning, we were on the runway. We were unable to take off. But when the president came and then gave out his statement and declared a state of emergency for people to stay at home, then we took off from the runway. And now we're in the clouds. We have our pilots being the Ministry of Health, but we need a co-pilot, and the co-pilot needs to be the president. We have daily briefings, from the Ministry of Health. But
all heads of government institutions, parastatals,
I'm just appealing,
private enterprises, and other
as a
institutions.
concerned citizen and a Gambian for that matter, who stands for social justice. I'm appealing to the president, even if it's going to be at least once in a week, to join this daily briefing. Not even daily, but then just once in a week, if he can join the briefing, the press briefing with the Ministry of Health. Like I said, he needs to be the co-pilot so that this plane can land safely and then land in a manner that will help all Gambians.
Yeah, you also mentioned, because you are very current about the situation of the Gambia, you understand that the Ministry of Health conducts a daily press briefing to update the country as to the situation of coronavirus. So why must the president also be on the fray to do a side talk also on the same issue?
The reason why I mentioned that is because as a leader, God has gifted you with the gift that whenever you talk, people listen. Okay. And at the time we're in a critical moment. We're in a crisis, and when crisis happens, it affects people mentally. People are in a panic mode. People are having high anxiety. But if somebody comes out as a leader and then speak to the people, he doesn't have to do it daily, but at least once in a while, if he comes out and then talk to people, that will reassure people. Reassurance is critical and important in a crisis like this. Reassurance reduces anxiety. Reassurance gives people hope. Reassurance makes people to have a steady of mind.
Okay.
Just think of it. Before he came, people were having high anxiety. When he came, at least it got better. So I'm just appealing as a concerned citizen, because I know the anxieties that other people are facing and the kind of stories that I'm hearing from other people.
Okay, just a quick one. We've seen also this is, like you said, America is one of the epicenters right now, no more China. So how is their mechanism or response activities affecting you as a Gambian in a foreign land?
All of us are in this together. Like I said, it affects us one way or the other. And the response mechanism, of course, I'm working at home and taking care of my child at the same time. So it's like I'm doing dual role, being a mother, babysitting your child, and also trying to work at home to make ends meet, because you got to pay your bill. You have to take care of back home So then you need to continue to work. So of course the response is affecting us, but I'm just appealing to the general population in Gambia. It's affecting us here, and it's going to affect you people also back at home in Gambia when the president declared stay at home. I'm just appealing, please do as the health official said, follow the precautionary measures and then stay at home. I don't want what has happened here to happen in Gambia, and I am not praying for that. People are crying here. People are dying. Some family members are dying. And then imagine being in your sick bed and then facing end of life, and you're not even able to see a family member closer to you to come and talk to you. It's sad. Some people telling me they are unable to have their 2 meals in a day. Not talk of 3, but 2 meals in a day is difficult for them right now. Their hours are being cut. Some people are not even working at all. I don't want that kind of situation to happen to them.
I get back to you shortly, but before then, let me engage Mr. Balde Gibi. We've seen the concern is almost the same all over, that the ministry is the core in the drive to of this fight against coronavirus, for example. But you know, what is the efficiency on the ground? Because initially the minister would talk about, you know, we are working on strengthening health facilities, health workers are to be strengthened. So, but the Gambians, are they really feeling the work of the ministry for the meantime?
Thank you very much. I would just like to also thank my sister there for those brilliant suggestions as he made. In this fight, as EMC rightly mentioned, we are not in this alone. This is the world over. But coming to Gambia, as Honorable said, since the initial conception of this disease, that is from Wuhan in 31st of December 2019, the ministry through the Directorate of Health Promotion and Education, as the communication unit which I represent, have since then we started work towards, you know, creating awareness, sensitizing the population, because as we know, you know, giving people the right information is the best means of engaging the people to change behavior, because most of the things surrounding this coronavirus preventive measures come down to behavioral change, because when you look at the hand washing, you know, the social distancing, you know, coughing, not coughing with your hand, but coughing with your bent elbow, you know, these are all things that, you know, are behavioral, and then that's why the Ministry of Health, through the Health Promotion Directorate, deemed it very wise to engage the population at a very early stage. And since then, before January, that is December, we started these sensitizations. We've been given TV program time and air time on radio stations. So instead of our routine, you know, sensitization on other diseases like hypertension, diabetes, which we were more concentrated on just before the emergence of this global challenge with the coronavirus. So we had to put those all down and then pick up the coronavirus and put it on the table of discussion. So since January, the Ministry of Health has been engaging the population, and we can see that the impact of that engagement in how people are taking this on their own, you know, trying to now stay away. Well, even before the declaration by the president, people were voluntarily isolating themselves, you know, avoiding, you know, overcrowded places. You know, since last week or week before last, when you go around Westfield and other places, the place started to get empty. And by then, it was even a week before the president even declared a state of emergency. Because as we see this all over the world.
The message is going.
So the message for us, the communication is doing very well.
It's vibrant. So,
and then you can also see the hand washing facilities all over the Gambia. Even locals at village level are turning these 20-liter gallons, empty oil gallons, into, you know, wash hand facilities. So that shows the response and the impact of the social, communication or the risk communication impact on the population.
Okay, very nice. And Honorable Sila, you alluded to the fact that the National Assembly was not left behind. In fact, you wake up very early. So, but that also didn't stop the fact that all cases, these 4 cases confirmed in this country, were imported. The first case we remember is as a result of a traveler from the United Kingdom. The second case is a Bangladeshi. The third case, a Gambian who returned from France, and actually even the fourth case was someone who traveled all the way from Europe, France. So meaning, we cannot notice the effect in terms of the number of cases in the Gambia to the early response at home level here.
Well, thank you very much for that question. That's very good. But before that, just issue that the lady was talking about the president coming to be talking to the population. That's fine. But for us, what we recommended and is being abided, being done by, implemented by the ministry is daily press briefings, daily updates. But for us, we've also suggested that it is the Minister of Health who should be doing that. The Minister of Health, in our report, we insisted that it's the Minister of Health that should take a lead. They should take the lead. Of course, this goes beyond health. It has other wide-ranging ramifications, economic, social. So all the sectors that are related, that have something to do with this, in terms of livelihood, in terms of lives, should be part of it. In fact, in our recommendation, we even recommended for an interministerial committee that will be looking into this issue from a wider spectrum. You will have health taking the lead because it's a health issue. Yeah. It is a health issue, disease. But you should have Ministry of Finance because they are the ones who are responsible for the resources. You have Ministry of Tourism, it affects the tourism. You have Ministry of Trade, it affects LUMOS, the markets, the traders, all these things. How can government come? Because they'll be discussing. But our suggestion is that if you have that high-level body, the president will be there. Of course, the president can come in like declaring this state of emergency. But when it comes to technical issues, it should be the Minister of Health who should be coming on a daily basis to be updating the population. And in fact, I want to take this opportunity to appeal to media outlets that if let us cooperate, let us allow the minister. In fact, we have been encouraging the minister to be doing this. Sometimes he would come, sometimes because of other engagement. But we are insisting, we are also urging him to be doing this on a daily basis for him to be coming. You have this technical committee. They can meet in the morning with the media, but evening, they can even dedicate a time in the evening where everybody will be glued to your TV, listening to the Minister of Health to update the nation. Even if this is the same thing that he said yesterday is going to be repeated, but we need this update. I want to once again appeal, make this, to remind him that this is what is needed, that the minister should be doing this. It's the minister who should be doing it.
Okay.
Yes,
so
and
that
would be quite assuring.
Also because in built up to the response mechanism in the country, you rightly highlighted that the National Assembly did a lot of background work. Indeed. Yeah. However, on the very day of the confirmation of first case, where the president also declared ban public gathering, the following day saw the National Assembly suspending sessions when they were. Don't you think that that was a time the National Assembly was needed most?
In terms of what? So for sometimes, some commentators, it's good for people to know what are the roles of the institutions. Some people, they just comment, they are just commentators. They comment. Well, sometimes out of concern, we don't blame them, out of concern, but it's also good for them to be doing research. Because National Assembly, suspending sittings, of course, we wanted to proceed, we wanted to do it in a given way. Of course, we did it in a different way. But what has happened is that it is at the National Assembly, you have oversight bodies. You have the Committee on Health. We have done what we're supposed to do. Go on the ground, engage the ministry, inquire about the level of preparedness of the country, task them, go on the ground, look at the lapses, the challenges, the gaps, identified those gaps, and then further task them that this is how you should be filling the gaps. Okay. And then you've also asked a very interesting question that despite all the preparedness at the level of the entries, all the cases are imported. So how did that happen? But this disease also is deceitful. Sometimes, because like I said, in our outing, we found that the only point of entry that was fully prepared was the international airport. And the first case passed through there. In fact, all the cases passed through there. The reason is because the disease is deceitful. The person, because what they have there, their equipment, you have this thermometer reading, temperature reading. So if you come and then you don't manifest the symptoms, you don't have any fever, your body temperature is not high, it would not detect it. So you can pass when you have the virus in you. So this is how it happens.
Yeah.
But in terms of having all those equipment in place, in terms of holding center, the airport was in fact in a ready mode, very ready. Other than of course we found challenges at the level of SIFO and at the level of course Karang was much better.
Border post.
It was not adequate. But the ports also had some challenges, which we highlighted in our report. So coming to this emergency, I think the recommendation that we've given to government, that this intermediate health committee, in fact the minister told us that it is constituted, but we want to see it really in full gear, that now is the time for them to sit down. And then not only at the level of the ministers, in our recommendation we are also recommending that there is need for a consultative body. The ministry has set up this technical body.
Okay.
They have technical committees. We are taking the lead. But there's also this need to have this consultative body where you'll have retired medical workers, former ministers of health, if possible, former secretaries of health, former directors of health, civil society, NGOs, all of them coming on board. Any person who has anything to add to it. Gambians have been engaged in emergencies in other countries. They have experience.
So who will be there to coordinate or
no, it's the minister that should be. It's the minister that should be under the Minister of Health. They should be taking the lead. And for taking the lead doesn't mean they'll be taking everything, all the decisions. They have to do it in consultation. Of course, and things that are dealing with health, it is themselves. But that issues that have other ramifications, other implications, they need to consult.
Would the National Assembly Select Committee for Health need to develop a framework
our recommendations? We have done what we are supposed to do.
Okay.
Prepare a report, make some recommendations for them. So it's a question of making a follow-up on those recommendations, whether they're being implemented. And I told you that by and large, part of the recommendations are being implemented. All these things that you hear, this ban on the travel restrictions, because for us at that stage, Gambia could not have closed its borders. Because Gambia shares borders, land borders with only Senegal. If Gambia did that, Senegal would have seen that as an act of aggression. People must understand diplomacy. So Gambia, what we tasked them was that they should engage the Minister of Foreign Affairs, that is health should engage Foreign Affairs, to engage Senegal. That since this is there is need for Gambia to close its border. And this is what they eventually did.
Okay. Yeah,
so, and then the airport also. So, but I'm concerned about this public emergency because I've heard operators that they are going around closing shops and the like. So it is important, like I said, they need to reinvigorate that interministerial committee. It has to start work. To come and see how government can come up with responses to caution the shock, economic shock, the impact that it has on these operators. What does government have in terms of relief? This is the time to think. So and that's for the executive. Of course, if it comes to a stage, the committee can convene and then also give further recommendation as to the way forward. But government really needs to come on board to really help those that are being put out of business. According to WHO, there are two main recommendations, and if we abide by that, and that is what China had learned. That is why the West, because they felt that their systems are so robust, they have very good health systems, that they care less about prevention. And for us, it's not a lost cause. If we really emphasize and adhere to the recommendations of WHO, social distancing, hand washing, we are going to really preempt this. We will really limit the impact. Of course,
we will get back to you shortly on the relief aspect. But before then, just Mr. Balde, you've seen, in fact, actually, this is a question that goes to the ministry all the time, that the ministry has not discovered any case or confirmed any case by its own. It is all the cases are almost as a result of people reporting themselves to the ministry. So it means that the ministry is somehow blind in spotting the real cases within the community.
No, I will not agree to that.
Okay.
Yes, the fact being that the first case came on the 15th, and on the 16th, she is the only one who reported herself. All the cases, apart from the first one, the second case was reported at the facility, and the facility contacted the 1025, which have the rapid response team, which sent the rapid response team to intervene. And the third case, also the 71-year-old from Numuyal, was also contacted through the 1025. That is the toll-free number that anyone can call if you want to give out any information related to the coronavirus. So that one also, because she came on the 17th from France and then went to the village at Numuyal, So there, he was there with the family, and then it was a concerned citizen who reported that there is somebody who is having some signs and symptoms and is from France.
And actually,
and then the Ministry of Health, laboratory scientists, these are the people who were deployed up to Basse to go and collect the sample, and then bring the sample up to here to MRC, where the lab is, where they do the test. So just even by looking at that, you will know that this is not something that we have missed. And looking at the fourth case also, it was also reported through the 1025, because this guy, if you could remember, arrived here the same day with the first index case. That's our first case on the 15th of March. So look, from on the 15th of March up to the day that it was reported through the 1025, you can see that it was through the efforts of the ministry, and then this 1025 is part of our communication committee strategies to make sure that we get access to information from people who we cannot see physically, and then they can just dial this number, because this guy, he was reported by another concerned citizen who saw him, though not from his own family members, because for them, they have been living with this guy for more than a week or so, and they didn't report. Okay. It was after till a concerned neighbor saw this guy and then called the 1025, and then the rapid response team was sent there. So looking at this, you can see all the three cases were captured through the 1025. It is only the first index case who came on the 15th, and the following day detected some signs and symptoms, and then reported to the MRC on her own.
Okay.
Yeah.
So yes, before we just go, maybe Fatou, you are on the line and you've seen the response mechanism in the Gambia here, and suppose it is in US, how is it like? Would you kind of have any advice on means to adjust to some level or kind of maintain certain principles?
First, before I come to that, I just want to thank all the advocates down there and the Ministry of Health with the wonderful job that they're doing. I have seen the level of advocacy and the sensitization going on the ground, but I would just want to say, if we can have the press briefing also translated into different local languages for the benefit of those that are in the rural areas, and also have a specific time, let's say every 4 p.m. there will be a press briefing, and the press briefing will be in the TV and all the radio stations. It's a collective effort. All the TVs and the radio station needs to come and then play their role, so that all the people cut across the Gambia will be able to get this information on a daily basis. And just coming back to your question.
On the response mechanism that you notice is ongoing in the Gambia now.
Yes. The stay at home is good for people to stay at home, but the response of the stay at home, everyone is adhering to that 100%. And I understand from the point where some people are coming from. Some will tell you, I cannot stay at home because my daily survival depends on the street. I go and then sell. Some will tell you, I go to the market to sell fish and then come back, whatever I get from that, that's what I use to eat with my family. So if you tell people to stay at home, of course, it comes with consequences, not only economic consequences. This whole thing has to do with the psychosocial consequences.
Okay. So
how prepared are we as a government to provide provision for these low-income families? I know my uncle talked about providing some means for the small businesses, like how do we have the small businesses that sells? But also, let's not forget about those people that are low income, whom in the morning they will get up as early as 5 a.m. to go and sell in the market and then come back, and then that's how they survive with their family. What do we provide for them? What are the provisions that government is ready to cater for them in terms of staying at home? Because if I'm to stay at home, of course, the next question would be, where will I get food to eat? And this also comes back to collective responsibility. Government will do what the government is supposed to do. But this is the importance where love thy neighbor comes. Okay. If I happen to get, let's say, 10 bags of rice in my house to prepare for this crisis, and a neighbor next door did not even have 1 cup of rice, this is where generosity comes. Take some part of the provisions that you have and then help your neighbor. we're in this together. Government will have to do its role, but then Gambians, as generous we are, we all know that we are all generous. It's either we are Muslims, Christian, or whatever religion you belong to. Our generosity, we all know it. Gambians are very generous.
Okay,
let's help each other this time.
Let me get back to you quickly, and then this takes us to today's press conference, because the Ministry of Health and Social Welfare maintains a daily and regular press conference, and today the issue is at least 2 Senegalese fishermen were intercepted for allegedly running away from coronavirus from Senegal. We know Senegal have registered more than 100 cases, and they are subjected to compulsory quarantine. So in this video, we watch what the press conference had to offer today.
2 Senegalese fishermen who claim to be running away from the COVID-19 outbreak in their country were also intercepted at sea yesterday by security personnel. They have also been put in quarantine. A gentleman who recently arrived in the country from France and was since evading quarantine has been found through the 1025 hotline and put in mandatory quarantine. The cumulative number of people quarantined to date is 247 people. The first set of people to have completed their 14-day mandatory quarantine are planned to move out of the quarantine facility tomorrow, 31st March 2020. They are 5 in number.
Okay, so to at least 2 Senegalese intercepted for allegedly running away from the coronavirus in Senegal have been, subjected to compulsory quarantine. And this takes me to Honorable Sila. We talk about the border. Your committee did go all around places, to including borders, to check the measure taken, there to prevent the coming in of this virus. So now, even in the president's speech, we talked about the closure of airspace and land, but sea wasn't mentioned. So technically, can we say these people defy border closure?
Well, yeah, you see, in Gambia, of course, from African countries, if you look at the way our countries, the geopolitical, our territories, the borders are porous. We have official border points, but you can see some communities, that are in between border lines. So it's very difficult for us to effectively police our borders by officials, I mean, state institutions, state structures, state officials. So what we recommended is that the Minister of Health and now the National Assembly members have been tasked to go out to sensitize those village communities, those communities, borderline communities, that any person that comes, either relative or stranger, they have to inquire from the person as to where he or she comes from, and then alert the health officials that we have got someone, it's my relative who is coming from Senegal, and Senegal is a country that you have, that has been affected, and the health officials would determine as to what to do. But this is what we're telling them. Of course, with the official entry points, the institutions are there, you have the immigration there, you have the police, you have the health officials to be doing the necessary screening, necessary check. And now, of course, with the border closure, it has scaled down traffic in terms of traveling. It's only essential traffic that is allowed. So there's that area is east. So now the challenge is those that enter. Some in fact they enter not through villages, but they enter through through forest, through the bush, into our country. So I think that's the challenge now. How do we sensitize communities that are on the borders to be tracking people that are coming? But of course, we don't ask them to be confronting any person who comes, because the person is infected, you are endangering them. So, but they can, maintaining this distance. We'll be telling them, maintain social distance. Anybody who comes, even your relative, stay put, inquire, call the health officials. Now, like I said, these are extraordinary times, so it needs extraordinary measures. These are not normal times. It needs measures that, just imagine a stranger, a relative coming to visit you, these abnormal times. That's not normal. So I think these are the things that we should be doing. Of course, yes, for us, we included all the borders, land, sea, air, as far as we're concerned, because you can see our engagements. Of course, it was only the ports, but now you can see the fisher folks, Gambians. There is this boat that comes from Betenti in Senegal to Banjul, that used to come from Banjul to Senegal. So we're expecting officials to be, concentrating on that, the Banjul beach, the boats that are coming, the Tangi beach, Gunjur beach, those beaches where you have, these fisher folks moving.
Fishermen, yeah.
So they have to be very vigilant as far as those entry points are concerned. But of course, it is an entry point. Okay, and on also the issue of I was talking about government trying to come up with relief, how to help. Like for instance,
let me just reframe that question, because already we know that the government of the Gambia have pledged $500 million, and in fact the Minister of Health was empowered to dispense the fund. But how would this be done? Isn't it the role of the National Assembly to decide where the money should go?
No. You see, for us, we don't decide. It's what we did was our role is to be approving their budgets.
Okay.
They would come with a budget, we approve it, it becomes into law, and we call it Appropriation Act. That is what the National Assembly does. It is the ministry that decides, it is the executive that decides that we have this amount of money, we want to spend it here. It's not the National Assembly. We don't tell them where to spend the money. They would come and tell us we want to spend it here, and then justify it, and then we approve it. This is how it works. Okay, and we have already approved a budget. There's an Appropriation Act that is in place, a law, and it's a law. Act means a law that's in place as to how much government is expecting in terms of revenue, and where it should be spending that. This law, this codified. Okay. Now the government wants to take 500 million from that. It's not coming from anybody's pocket. It's not coming from any country. It's from this Appropriation Act. That's this 500 million is coming from. And then we dedicating it to health in terms of this response to this COVID-19 disease outbreak, this epidemic, this pandemic. Okay. So what we are going to do, and what we are supposed to do as a National Assembly and also as a Select Committee, is to perform oversight to ensure that this 500 million goes to nowhere other than responses to this COVID.
Okay.
Because there'll come a time.
What is the timetable, and is it now that the National Assembly should start checking and auditing, or it has to wait?
No, government has its own processes. You have institutions that do auditing. They would do auditing and then come to us and then tell us what has been happening. Okay. So
maybe you hold on. Let me just come to.
I just wanted to say something regarding. Okay, you can. But just wanted to say, like, for instance, they're talking about the types of intervention we are expecting from government. They're talking about drivers. Like I said, a vehicle that carries 4 passengers, they said 3 passengers. Yeah. So how are we going to? Now minus 1 passenger. If it is $8, 8 times 2, 8 times 4. That's
I have a slot for that. Maybe you wait for. Let me see how the PS contextualize it. Yeah. So, Mr. Balde, you've seen that now the ministry was looking for money, and now there's money. Was looking for support. More support is coming in now. How is this money? Expenses domesticated. The ministry is not able to explain so far how much is being spent. I think
but the minister yesterday even said that yes, the monies have been approved, but it have to go in processes before we get on our hands on the money. So, and then yesterday during the press briefing, I think your guys were there, he made explain, because a journalist asked, how is this money going to be used? And he made an explanation to that health workers need to be trained, communities need to be sensitized, through billboards, through radio programs, TV programs, and all that. After that, also equipments need to be bought for protective equipments, because we have to put in the back of our mind that this disease, those who are in the front line are the people with the highest risk of contracting this disease, because as we have learned, we have lost almost globally more than 5,000 medical workers or health professionals due to this coronavirus. So putting that in at the back of our mind, we also will not want to put that risk on our Gambian health workers, knowing that even the numbers are not that much compared to other countries. So that being the case, PPEs, that is personal protective equipments, will be bought, and then other materials like spraying equipments, spraying chemicals, because you need to disinfect places, especially places that are found to have confirmed cases. For example, homes of people now who have been tested and confirmed to be having the coronavirus, those homes should be disinfected, and then even the certain public facilities like we saw last week at the ports, they were disinfecting the ports. So it goes along, and then when you look at the National Health Emergency Committee, that is the big framework committee that is having around 6 subcommittees within this National Health Emergency Committee. You have the communication subcommittee, you have the case management subcommittee, you also have the psychosocial subcommittee, you also have this disease surveillance, subcommittee. So all these subcommittees have needs and activities.
Yeah, exactly. This is a Gabriel, because the only concern now is all these things you are talking about, and all this remains to be planned. Now that there is a money pledge, why is the money not spent now?
That's what I'm saying. The money is not in the hands of the ministry right now.
So who should collect it now?
So the money should be put into the central bank through the treasury. There is where ministry will now get access to the money.
Honorable, you have idea when is this going to happen?
Well, you see, sometimes government does not have money just to stash somewhere. Sometimes they have to.
It is virtual.
Yeah, raise funds. That is, they call it this bond, these treasury bills, and then revenue. And it's a tax-based economy, so they'll be expecting this revenue from GRA. So, but it's the Ministry of Finance that is in a better position to explain.
This.
But we have approved. Well, the executive has decided to take 500 million from the act, the appropriation act, from the money we passed for the response of this.
But wouldn't government know that, wouldn't it find out whether the money is there or not before it makes a public pronouncement?
No, the money is there. The money should be there.
Okay, so Fatou, that takes me to Fatou Sisa. You were in the US, and you part of the campaign supporting the Ministry of Health, raising funds through the online platform. Fatoumata, how far is that campaign going on?
Yes, so far we have disbursed some amount to buy some of the materials that we have in Gambia, and some of our volunteers are ready, I can say now, to get them distributed to various hospitals. And this time around, we're focusing more on the rural area, because it's like most of the donations are going to the urban areas hospital. Tend to ignore the rural areas, and that will make me also, just to suggest to our wonderful health workers. I'm thanking all the frontline workers down there and the Ministry of Health for the wonderful job. But I just want to say, okay, we are saying the money has not been landed to their hands, but let's have plans ahead. Let's have consultations with regional health directorate. I know you have already started that, but then if we can have treatment centers in each of this region, because we don't want, when it gets to worst, which I'm not praying, for Banjul to be the epicenter, everybody coming to Banjul. Let's have regional treatment centers set in place. We need to be prepared, like my fellow panelists said. It's an emergency, it's a crisis, so we need to act swiftly. We need to respond to this quickly. Let's set up those treatment centers in each of these children. And another way that we can do is, if we consult them, we will be able to find out what are the materials needed in, let's say, LRR as a major hospital in Soma, what is needed there, what is needed in Bansa. Not all the hospitals in each region, but every region there is a center and a main health center there. So we can use those main health centers as the treatment center for that particular region. And then all the materials that are needed now that we have the money, and also the supply that came from China, I saw it, we can distribute it accordingly. When the time comes for us to treat people, we'll be ready and then stand by and have all the PPE that the frontliners also need.
Okay, so now quickly we'll, Musa, you there, so we try to check on what the Permanent Secretary said about, because the lockdown and the stoppage in public gathering and the rule on the transport already is having effect on the livelihood of people. So today we discussed with some drivers who expressed disappointment, but the Permanent Secretary at the Ministry of Transport and Construction Mod Cisse, spoke to iAfrica as to the aim of the entire system in place in this video.
Has now become global, and WHO and the Ministry of Health have come up with recommended guidelines to make sure that governments protect their population, and the population also protect themselves. It is within that context that this particular measure is part of the proclamation by the President last Friday, May 27.
So the degree or the enforcement of this transport procedure has also noticeably led to a shortage in vehicle, and people are being stranded in the wee hours of Monday today. So what solution is likely to be on the ground or at the disposal of the ministry for the public to understand that this is hopefully temporal?
Hopefully this is temporal, because we don't expect state of emergency to be long if we all do what we have to do, protect ourselves, stay at home, exercise social distancing, practice basic hygiene for ourselves and our families, then the chain of cycle of transmission will be break, and in that way we will exit from COVID-19, and that way the period will be short.
So
now the other option is there. Failing to do that, the implication of that would be that the emergency period may be extended, other drastic measures may be added.
So the Permanent Secretary was here in the morning to discuss, because drivers are expressing concern that the measures being taken by government, hopefully through the advice of the Select Committee for National Assembly and the Ministry of Health, is now having impact in the life of the people, and people don't like it. So, Sila, how do we digest this?
Yes, in fact, as a follow-up to our recommendations, we have been engaging the ministry, and then what we further recommended to them was that they should be engaging in consultation. Well, of course, there is need for the social distancing. That's one of the key measures that is going to help us get a turnaround to come out of the woods. But we have to do it in consultation with taxi drivers, with the unions. There are unions of taxi drivers. And like, for instance, if you are asking the drivers to limit the number of passengers, and then you're talking about the price of fuel is at the same place, there is no subsidy from government in reducing the price, or because we are not expecting the prices to be increased, that for them to cover up the reduction of the number of passengers by increasing prices. At the end of the day, is the consumers, the commuters that are going to suffer. And you understand this country, there's a lot of hardship, economic hardship, that people have to be contending with. So these are the things, like I said, that was the reason why I was emphasizing for this interministerial committee to really start working. They have to come, sit down, assess the situation from the wider spectrum. This transport issue, like I said, the Minister of Transport should be part of that committee.
In your view, why is this interministerial committee not?
No, it is in place according to the Minister of Health. They said that it is in place. But what we are expecting from it is that these measures that they've started, asking businesses to close down, as I was informed by some auto mechanic garage owners, that they have been asked to close down. But where would they get their livelihood? So these are the things the government should be thinking. It's good to protect health, but also we shouldn't be protecting health and also people suffering as a result of protecting health. So how do we, it's a juggling, how do we do the balancing act? And we can do the balancing act, definitely. Government can come, like I said, it's not normal. So there are abnormal interventions. But how can government, what sort of measures can government come up with so that it will caution this impact? Yes, we need our transports to decongest. People should not be, congesting in public transport. In fact, the first place, people should not even be going out, because we're asking them to stay at home. But if they stay at home, what are you providing for them? Because they are going out to fend for their families.
So the ministry is concerned about prevention and protection rather than the, social welfare of people.
Yes.
Is that the case?
Yes, because here we are talking about public health. That is the health of the population. And when you look at the drivers in the population, it's a very small margin. You understand? And these are who you are directing your complaints to, or who are directing their complaints to you. So here we are trying to safeguard the whole population, and this is evident by the number of cases in certain countries. Like in Italy, we have seen now the cases is going up to 100,000 because they are past 80,000. In America now they are talking about almost 100 and something thousand cases. So this is a problem that when it hits us hard, then the consequences will be far more, dear than the complaints that we are getting from the drivers. And
so, Fatou, you get that? So there is a measure of dictatorial to sort out the issue about this coronavirus. Is this American style too?
Yes, having all the institution in consultation, like mentioned in one of the panelists just said, is important because this virus does not only affect one sector, it affects all sectors, it affects everyone. So in consultation with all the ministries is important so that the transportation will be taken care of. Maybe cutting down the fuel, the amount of fuel, the prices that will help the drivers so that to replace the number of passengers that they have cut. Coming to the tourism sector, those that work in the hotel industries, they're not working anymore. What provision do we have for them? And those individuals, I will repeat again, I'm a social justice fighter. The individuals at home who are vulnerable, who are voiceless, their voice cannot come out to say what they are struggling with and not having their daily square meals to eat. What do we have for them? We need to act now.
Okay.
The time to act now.
We leave it there with that question, Fatou. I'm sorry, I have run out of time right now. So it was a special panel to update the world on the status of coronavirus in the Gambia. So for the past 1 hour, those who have been with me is Usman Silla, of course, Honorable, who is chairperson for Select Committee on Health at the National Assembly, Gabriel Gandobalde, Program Officer Communication Unit under the Directorate of Health Promotion and Education, and Fatou Cissé on the line in the US, who is a social activist and then social worker and an activist in the United States, Gambian-based. United States-based Gambian, excuse me for that all the time. And then it was me, Ibrahim Presper, who was moderating the session for you. Until tomorrow, we continue listening to iAfrica, tuning on through www.iafrica.tv for more programs and more on coronavirus. Until then, bye-bye for now.
My fellow Gambian brothers and sisters, this is a message of precaution, solidarity and hope. We living in very unusual times. The coronavirus is a menace that's threatening all of us, but together, united, we can do something about this. First, we need to take necessary precautions and take expert advice and act accordingly. Stay away from crowded places, wash our hands and use hand sanitizers where necessary. Let us remain calm and hopeful. There is a God, that God is alive, Allah will take care of us, but we have to take the necessary precautions. There is a number that can be called to report and to ask questions. Let's use it. Together, we can fight this menace, and we know Allah subhanahu wa ta'ala will be there for us. Let's remain calm and hopeful. Inna Allaha ma'as sabirin. Let's be patient, calm, take precaution, and do the right things. This is a message from your brother, Muhammadu Sabali. Assalamu alaikum.